I want to bring in Dr. Scott Newsome. He is a neurologist at Johns Hopkins Medicine and a director at the Stiff Person Syndrome Center. First of all, welcome, doctor. Thank you so much for taking the time to speak with us today.
Thank you for the invite.
This is a syndrome that a lot of people may not know about, stiff person syndrome. It does have another name as well, but commonly known as stiff person syndrome. Can you tell us a little bit more about it and how it shows up in the body?
Sure. So, as many may know, this is an exceedingly rare neurological condition that is felt to have an immune mediated process. And it's really thought to be a spectrum of disorders. But most commonly, it affects the musculoskeletal system where people have really a significant amount of pain, spasms that can really affect any muscle within the body. And we have seen, well, I should say it's quoted at 1 in a million, but I will say it's probably more common than that because it's an evolving spectrum of symptoms that we're seeing, including eye muscle issues, gut dysmotility problems. And so it likely is under-recognized.
And so the cause is not known at this time, doctor, from my understanding. But do we know more about who it afflicts?
Sure. I think it's very similar to other autoimmune disorders where women are affected more than men. When we look at the totality of people that are studied with this spectrum disorder, it's usually 40s to 50s is when it presents, or at least when it's diagnosed, I should say. But with any disorder, it can affect even children or people later in years in their 70s or 80s.
And so what are some of the options for treatment? What kind of things are available? Because I think that Celine Dion was saying that she's working with occupational therapists. Can you talk to us a little bit more about what people would have to do?
Absolutely. So my approach is looking at this from a multifaceted treatment approach where we have pharmacotherapy, non-pharmacotherapies. Sort of the gold standard is treating people with muscle relaxers. But given that it's an autoimmune condition, we do use, in most people, immune-related therapies to help. And then other non-pharmacological therapies, as you mentioned, occupational therapy. We have people utilizing acupuncture, massage therapy. So there's really a number of things we can treat people with this condition with. But I will go back to it's really a multifaceted, multidisciplinary approach to treatment.
And so when Celine Dion's fans are thinking about her and hoping to eventually see her on stage again one day, what does the prognosis of that look like for you? What are the prospects like for somebody like who is a professional performer like Celine Dion?
Yeah, it's always hard to know, right? It's hard to speculate how someone will do in the future. I will say we have seen a number of people get back into some normalcy, if I can use that word. And then there's others where, despite our great efforts, they, have to, take a back seat, so to speak, in terms of maybe limiting what they do overall. But in keeping the holistic treatment of at the forefront for treating people with this condition, I do think people can improve their quality of life, but it does take a full team.
Dr. Scott Newsome with the Department of Neurology at Johns Hopkins University School of Medicine. Thank you so much for taking the time to explain this all to us today.
Thank you so much.